So I'm Robbie Preece. I'm a health improvement lead for tobacco control for NHS Greater Glasgow and Clyde, and I've not really done any kind of background around Glasgow, but I thought maybe after the discussion just a few kind of pointers around the size of our board. So I think we're the biggest health board organisation in the country, okay, in the UK maybe, because it's all a bit more broken up in England. And we're certainly the biggest board in Scotland. We're 1.2 million people, and we go from Easterhouse all the way to Kirk and down to Renfrewshire as well. And we do have the best smoking rates in the country. We have got some pockets of fantastically high smoking rates, and that is the main reason that we have a significant effort in terms of tobacco control in our board. Okay, so it's always good to put your interests up. And Andy, where are you? I think I owe you lunch.
You do?
Okay. So we'll do that one day.
No.
And I think that one of the key things I always try and get across is that in terms of the taxpayer, you know, we're all you people are funding my role and my job. So it's really important that we engage with all the organisations that are out there. And we're all taxpayers in this room. Hopefully Konstantinos is paying tax in Greece, because they probably need it more than we do. So anyway, we'll move on. How do I do? Press this one here. Try that. Yeah. Okay. Yeah. So a bit of background. So smoking cessation services. Sometimes people can't even say that word properly. So stop smoking services. That's what we're funded to deliver on, as well as wider kind of tobacco control work. Okay. And you see, this is. I'll put this slide up. You've got a pointer or anything? Or
no.
Yeah.
There
you go. There you go. Okay, so this is quit attempts from our target area, and our target area is the 40% most deprived data zones in within the board. Okay, so there's a Scottish index of multiple deprivation, and it's split into 6,000 data zones across the country, and that's how that's ranked. Okay, so you can see that huge impact in the last kind of 3 years that's happened, and of course there are some people that think it's not e-cigs, and I really struggle to comprehend that argument. So it's really clear that the impact of e-cigs and vaping has done on the services. Okay, so some of the services are being decommissioned in England. You'll probably seen some of the articles around that. One of the main issues for us is the change in the target. We changed the target about 3 years ago, so Linda Bould's fault that was, made us all work harder, and she's encouraged the government to set a target of around 3 months rather than 1 month. We used to measure everything at 1 month, and then smokers were just left to it. That's what we did, because that was what how the target set us up. And now we're being measured at 3 months. So, and that has really changed the way we deliver services. So we deliver it now much more on a rolling model, and we support people for much, much longer. And you can see that with the number of successful quits that we've got at 3 months in this one here on the other side, this blue one. So even though the number of quit attempts has stayed the same, it seems to be levelling off, and this year it's actually gone up a wee bit, but overall it'll be about the same. The number of quit attempts at 3 months has improved quite significantly. Okay. And the main advantage it gives us really is with GP practices. So our teams have very much got to generate their own activity. There's no mass media, there's no TV campaigns anymore. The funding in terms of all these things that we used to do, throw money at bus campaigns and all this kind of billboards, is very, 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 very small now. So what the evidence suggests very much from the Smoking Toolkit study in England is that the leading trigger for making a quit attempt is advice from a health professional. And they don't mean a smoking cessation person, they mean a trusted health professional who's neutral. So sometimes our teams, they'll go and do lots of stores in Tesco's and Springburn, Fun in the Park every summer, and smokers, they know what these people are going to say to them. So it is that kind of working with health professionals to try and get them to raise awareness for them. And where we've done that in Greater Glasgow and Clyde, we've shown some quite significant increases in the amount of people that are engaging with the services. Okay. So we do very much try and concentrate on behaviour change, but in terms of GP practices rather than individuals. We can only reach so many people. We've got a finite workforce of 27, 28 staff, and they can only, if they have their own individual conversations, there's only so many people they'll reach each year. Okay, so GPs are really key for us. They all moan about their status in society not being what it was, but the evidence is quite clear that they still can inspire people to come to our services, and that's the main kind of thread that we've explored in the last year is trying to work with the teams to engage with practices more than doing their own work. Okay, so what's caused this drop? Okay, as I said, I really do struggle with some of the people that argue that e-cigs has not done this. Okay, so I showed this chart, the next one here. You'll know this one from Smoking Toolkit study. Yeah, does everyone know this one? Yeah. So what it shows is how the vaping took off in 2011-12. Obviously an early starter, Andy, you were.
Yes.
Okay. And the impact. And you look at our drop here. So you look at our drop. It kind of starts halfway through 12 through to 14. Okay. And you can see here, kind of halfway through 12 through to 14, the product of choice that people who are making quit attempts are using is e-cigs. Okay. So this is us along the bottom. This is in England. Okay, but this is us along the bottom here. Okay, behavioural support. So we see a small percentage of smokers every year. Okay, and of course we are the most successful method in terms of quitting, in terms of what the research suggests around pharmacology. Okay, so NRT, you take a drug, NRT or Champix, you receive behavioural support, your service should be able to reach a level of quitting at 4 weeks of X and a level of quitting at 12 weeks of Y, and so on. Okay, and what's changed that is e-cigs for us. Okay, so vaping. So the staff who work in cessation, most of them, they're there by choice. They choose to be there. They very much, they're very much into their work. I've never really worked with a group of people that are so kind of committed to their role, and they're very much, they're not working for the private sector. We're not having commission services. We're all funded and paid by the taxpayer, and they're all very much dedicated to that role, that kind of altruistic thing. So they're not on product-related pay or anything like that. Okay, so they're a group that consistently for maybe 8 to 10 years of work with smokers around their quit attempts, and very much work with them and to try and understand that it's not about the nicotine, it's about the products of combustion. And I've heard this phrase, and I used it 10, 12 years ago, and I've heard it many, many times over the last 10, 12 years. And what vaping has done really has taken them out of their comfort zone. Okay? It's caused quite a lot of angst in public health. There's a lot of heated discussions around vaping. There's a lot of caution around it. There's cynicism because of renormalisation, as Andy discussed. There's cynicism around the tobacco industry, and I find that all it's kind of fascinating. So I've kind of come in left field, really, from a community work background. And probably the most fascinating thing about it for me is that the staff, how they discuss that it's about the products of combustion. They use that terminology all the time, and now they've actually got something that can actually distinguish that. So previously, when it was smoking cigarettes, then the products of combustion do you the harm, so you need to quit. Whereas now, there's an alternative. And it has taken them out of their comfort zone very much. Okay? It's an easy thing to say, products of combustion, and they do, and they repeat it time and time again to try and get people to understand. And that's really why sometimes they're a bit uncomfortable with the vaping scenario, because it's not ever been a product like that before. Okay? So vaping really, it's a real thing for them. Now they can, that phrase around products of combustion, it's a real thing. So they can, in a way, they can take that away now. Okay? So because they've got an option. So it's not just about quitting anymore, it's about switching. But of course, we're funded, and we have a delivery model based on the research that was around 15 years ago in terms of NRT and more recently Champix. So that's what our role is. Okay? So it can take people very much out of the comfort zone within our field, but most people are kind of moving to the right, moving to the right understanding of it now, I think. Okay? So when vaping came along, we all reviewed our no smoking policies and put it in, because that's what we do, we ban stuff. Okay? I'm sure you all understand that. That's the precautionary approach we've got. That was about 5-6 years ago. There was only one health board in Scotland that didn't ban it, and that was Lothian. And most local authorities have either banned it or just kind of ignored it. Okay? So with the public sector, and sometimes we can be quite nervous and cautious around taking a leap. And often we commission the voluntary sector to do our leaping for us, and then we mainstream things a few years later. Okay? So there was clearly a lot of debate around it, and what we were looking for was this evidence that would support us to change our policy. So what we needed was, a great big groundbreaking report from Public Health England, and there it was, landed on our doorstep about 2 years ago. So what we need is evidence before we take leaps. And really the key thing for us was around this one here. Okay, this is what we felt very strongly about. Where is it? In red. Sorry, I can't even get this pointer to work. In red was that this misperception of harm that was out there, and there's been other studies too that show that, and studies that show that it's rising. And we felt that it was our role really to challenge that, and that was the main reason that we explored lifting e-cigarettes out of our ban. Okay. So this is from our health and wellbeing survey that we do in Greater Glasgow Clyde every year, and this, the fourth one here. Here we go. Okay. So we've only asked this question once. There's no trends. So e-cigarettes are just as harmful to health as normal cigarettes. 22% of people agreed or strongly agreed with that. Okay? So we need to monitor that and see where that moves to in the next couple of surveys. Okay, so change in policy within the health board. All right, that involves writing a great big paper. Okay, going in front of the board and seeking permission to amend it. It's a slow process. We're a big organisation. It can take some time. And that was agreed in December 15, and it's only just December 16 where we've finally done our leaflet for staff, patients and visitors, been through lots of committees, lots of changes. Andy Morrison spotted some typos after everyone else didn't. So, very helpful. Okay, so just to sum up. So really this is about our journey. How safe is vaping? And I suppose I was looking at this last night, and really what it feels like now is about our journey. We've gone from how safe is vaping, really, and I think maybe this might be a more interesting question today, how safe is not vaping, okay? So, what we know, lung cancer survival rates, this is Australia, so this is going back about 3.5 decades, when I was still at school, okay? All right. And you can see that increase has been very slight, whereas other cancer survival rates have really increased quite significantly. Okay. And it's the same for COPD. When I started doing this work 2 decades ago, then COPD there was no cure, and there's still no cure. Okay, so Dave, you're here, very good. I'm not just being a sook, honestly. Okay, so a wee plea. Okay, so quite often with the people I work with, I try and point them to social media because there are some geniuses on social media in terms of helping us, but there's also a whole load of abuse and noise and stuff and lovely language that you use sometimes.
I do. Both,
you
yes.
do, yeah, very well. Okay, so and amongst that there are some gems, and I was really taken with this a while ago, maybe 6 months, was it?
Yeah. You've been paid a while.
Yes, and I thought that was a really interesting thing to just put up from a presentation here at the end, and that's kind of, I think that's where we've, as an organisation, we're kind of moving towards slightly. Okay, right, that's me.
Robbie, I think you